Hi, everybody. Mike Schiller, Senior Director of Supply Chain for AHRMM. And I'd like you to join me in welcoming our esteemed panelists. We have Karen Conway, the Vice President of Healthcare Value at GHX, Raj Sharma, Co-founder and CEO, Public Spend Forum, and Bill Burke, CEO of HealthEquip. I think we're better positioned moving into these fall winter month periods with the potential for high flu vaccine or high flu and COVID resurgence, but we've got the infrastructure in place with some of these models.
And it really was, so AHA and AHRMM had really stood up to say, how are we going to help the industry? Obviously, the members, but really the industry as a whole, because at this point, as you said, the walls are coming down. And the one really positive thing about COVID has been this collaboration, whether it's between hospitals that have traditionally competed for market share, or whether it's manufacturers that compete, or whether it's other kinds of organizations providing services. So as you and I were talking back in March, we have a service at GHX called Vendor Mate, where in normal times we are helping to vet both organizations as well as manufacturer representatives who are going into the hospital and to try to protect both from, you don't want an unscrupulous person or an unscrupulous company selling to hospitals and healthcare systems. So we had this service set up and we said, okay, let's do something pro bono together. And as you can see, so the very last week of March, we vetted 112. That jumped, skyrocketed to 376 in the month of April. And as you can see, this has leveled out a bit. It's continuing to happen. I attribute some of this to the fact that we have some other players who are also doing some vendor vetting as well as product vetting, which we'll hear about in a minute. But you can see here that we vetted 886 between the 23rd of March and the end of August. And we're continuing to vet in September and expect to be doing this for quite some time, along with some of our other partners. And what you can see is only 392, or 44%, even past that initial vetting. And you can see over on the right, I've just characterized some of the factors that we look at in that initial vetting, because that's an important point. We're just trying to kind of let's pare it down a little bit so it's easier for all of the hospitals and healthcare systems. So they're not trying to vet everybody in the world. And then you were able to post this. So you can see we look at things like tax ID and business license. Most importantly, are they on some kind of federal sanction or exclusion list? What's their finances? And then spend a fair amount of time looking online to look at those reviews, any kind of history that would be red flags, eligibility to be doing work with the government, et cetera. But again, it's just a first step. And then we were able to provide that information on a daily basis and continue to do that back to AHRMM and to AHA for you to make this available to the industry.
We began to add additional requirements to the manufacturers to complete. What are your payment terms? Are there additional shipping costs? We wanted to understand any other fees and services that and costs, right, that these manufacturers might be tagging on. What's the estimated delivery time? A lot of this product, right, is coming from outside of the U.S. And so are we looking at a week? Are we looking at a month? What is your minimum order quantity? Some of these manufacturers and suppliers had some extremely high minimum order quantities that hospitals were never going to be able to meet unless they created a coalition among themselves to purchase that volume. So incredibly dynamic. But I think one thing I'd like to just reiterate that you stated was the pro bono effort. I mean, I think what AHRMM and GHX did was indicative of what we were seeing across the healthcare field and really leading by example. We came together and said, let's provide this to the healthcare field. Again, this first level pass, so that everybody at least can look at these 300 plus vendors that were approved. So as we received the information back from GHX VendorMate, we created our COVID-19 resource page, and we had all of the vendors that we deemed acceptable to provide low-risk vendors, and we hosted them on our vendor site, on this resource site, and we broke it up in 3 categories. PPE products, we had other products such as testing supplies, lab supplies, etc. And then we had another section for services, and this allowed our not just our members, right? The entire healthcare field, all supply chain professionals, to access this webpage. And then look, if you're looking for PPE, great. If you're looking for face masks and test swabs, you click this link. If you're looking for other resources, you click the third link. So we really, as the volume increased, we began to further build out our platform on the COVID-19 resource page to better meet the needs of our members, to better meet the needs of the healthcare supply chain professional.
And if I can just add one comment, the other thing that AHRMM started doing was allowing hospitals and healthcare systems to talk about the experience they had. Hey, I tried out the vendor that was identified as low risk, and you know what? It didn't work out. But I tried this vendor that was identified as low risk, and great, good service, did what they said. I got a quality when it arrived. So it is about this kind of crowdsourcing and bringing together because, as you and I had written an article for Supply Chain Brain, it was like sourcing the unknown. You don't do it alone. We've got to do this together.
What I'd like to do at this point is turn the conversation over to Raj Sharma to talk a little bit about the GovShop platform.
So GovShop is a broader supplier intelligence platform for government as well as related sectors to find anything, find suppliers. And so as part of that work, we have 1.9 million companies. We were brought in early on. I remember getting a call about, as the joint task force for the Department of Defense and the government was being stood up, getting a call late February from the U.S. Army, and in kind of a panic mode saying, hey, we need to figure out where all the PPE suppliers are. So it sounds familiar. And so we got to working, and pretty soon thereafter, as you could see on this slide, we were then working across the joint task force, really trying to help them not just understand PPE, but ventilators and the entire supply chain. And then soon thereafter, as you mentioned, got engaged with NGA, and that's how we met and started working together here. But over time, what we were able to do is, because of the scope of what we were looking at is a bit broader than just PPE, we were asked to really dive into a number of categories. And there's a slide that comes up next that speaks to some of those. But we ended up actually, because it's an open platform, GovShop is, any supplier can register. A lot of new companies coming in, as you mentioned, over 8,000 companies coming in and into GovShop. So we had roughly about 4,500 or to 5,000 of those already, but roughly about 3,000 more companies. And you can imagine, as Karen mentioned, what a massive undertaking to say, okay, how do you really distinguish from the suppliers that actually are legitimate to every broker that is, or consultant that's popping into the market as an expert now. So that was a challenge similar to the ones that we all faced. And so we also put a vetting process together. And as part of that, we actually went through over 1,000 suppliers, and we roughly, this slide actually says including 1,000 plus verified, but it should say we went through 1,000 plus verified companies and roughly verified about 500 plus companies. And that's because we're looking at a broader set of categories. So our numbers, Karen, might be similar and overlap a little bit. We also started documenting what products these companies are providing. So that was one of the other key things that people were looking for is, really understanding, are these certified products? What manufacturers are they coming from? What's the source? Is it domestic? Is it China? Where are they coming from? So we started documenting that, and that's all part of the GovShop platform. And then the other thing that comes up a lot of times is contracts. People wanted to know, because of the urgency, how fast can we go contract? Luckily, there's emergency procedures in place from a procurement standpoint, so many could go out, and especially government contracting, as you can imagine, is complex sometimes, and sometimes some of the hospital systems, et cetera, also have to comply with some of those rules, depending on if they're working with VA, et cetera. But we documented a lot of the contracts that were already in place. And then the other thing, I think, Mike, you and I have talked about a bit, is we've been working on a project, and not as urgent anymore, but still something of potential value, is price benchmarking, because there's so much, really not enough transparency in the market in terms of understanding where all the price is going for different types, whether you're talking about N95 masks or you're talking about gloves, et cetera. But going through that exercise and providing that visibility so we could give at least the buyers some level of confidence that, one, they're getting vetted companies, but two, the big question of, what should I be paying for this? Am I negotiating? And with a lot of new buyers coming into the market, they really were struggling with that. So we decided to take that on as well.
At this point, Bill, I'm going to advance the slide, and I'd like to turn the presentation over to you.
Next, let me take you into the HealthEquip Marketplace and just share a little bit more information about the Verified By program, as well as the user experience that I described. So as a buyer, I can come into HealthEquip Marketplace in an anonymous path and wait to sign in and register until I'm sure I'm happy with what I found. I can also then go all the way through on the platform and either procure what I found by credit card, or I can procure that using a PO method and procure that with milestone and progress payments, or what we call on account. And all that is handled digitally from the seller's perspective and the buyer's perspective with the marketplace. And so what you'll see here is a very easy ability to come in and search. In this case, it's just showing some of the items and suppliers that have been verified by, and I'll take this hand sanitizer by the Vertical Collective. While this fairly new seller to the marketplace has been vetted by AHRMM and GHX, we have completed also the FDA verified by step for this hand sanitizer by going all the way to the FDA source data with the documentation that this seller has provided. For their nitrile gloves, we're in the process, so that icon is not showing up yet. We're also in the process of gathering, will they be able to provide chain of custody information? Will they be willing to provide a sample in advance for particularly large orders? And so we're making it easy for the buyers to visually see, how am I selecting items from sellers, and how can I digitally handle a compliance? I can also go on for that hand sanitizer. I can click and download that actual FDA letter, that certified by letter, or that EUA letter, whatever it is that they have as compliance documentation. I can make that part of my digital process. And next, I want to share a bit more about the portal that they're able to have, and show that as a buyer, I can now go to Med2Market's portal. Not only can I see their other items, but I can see feedback. What are their reviews? Are they 5-star reviews? Are they 4-star reviews? I can see actual written reviews. I can understand more about any specific policies that they have. I also have access to all of the compliance information. So any of that documentation, they're able to share and post that. If they have additional product information, they're able to share and post that digitally, so that I, as a buyer, can move through that traditionally manual email back and forth, weeks of work and time, and move straight into having that information digitally. I can also, as a buyer, message them through the platform, work out any specific terms, and in the process of going through procurement, add a PO. If that's the way I'm going to buy it, I could buy it with credit card if it's a smaller amount, and then digitally follow that product delivery as well as financial progress payment through the process.
There's a number of programs in place, infrastructure that is in place, collaborative efforts that we've talked about that are in place, AHA with the Dynamic Ventilator Reserve Program, vendor vetting repository, and these different resources that our healthcare supply chain professionals and non-healthcare industry partners have access to. So I think, our theme here is you're not alone. You're really not alone. And the whole point of this presentation is to really point people to the resources that are available.